Thank you very much for those wonderful comments. And actually, the work that I did, I give credit to the women in Harlem who showed me the way. They were coming in too late. In those early years, in the 1970s in particular, women were coming into my breast clinic with ulcerated masses for the first visit. Very disturbing to me. And I set out to find a way to help them. It eventuated in two things that I knew. They needed to be screened in a timely way. So we set up ways to screen the women for breast cancer, free of charge if they could not pay. But that wasn't enough, because mammograms do not cure breast cancer. Surely you should have a mammogram, but something else had to be done. It was the hearings that Chris Morgan referred to that I held as president of the Cancer Society in 1989 that showed me the way. We heard the testimony of poor people who had cancer of all races. They were white, they were black, Hispanic, Native American, all American people, and all cancers. And what they said created the concept of patient navigation, because they said we meet barriers when we attempt to get into and through this very, very complex American healthcare system. We meet barriers, financial barriers, communication barriers, system barriers, fear and distrust, transportation barriers, whatever the barriers are. So that's how navigation came into effect in Harlem. And we showed, ultimately, that if you screen people who need to be screened at the proper age and assure that those who have findings are diagnosed and treated in a timely way with good quality, you can change the results of a poor community to results equal to a middle class and rich community, and we did that. So I'm very happy today to be with this group of people who are giants, truly giants. I'm not sure that I'm a giant myself, but for the moment I feel like I am, because you said I was. But it's wonderful to be here and to be recognized in this way. And let me just end by one point. We have a great discovery system, and so many of the people who are receiving awards here tonight have done great discoveries. But we don't have such a great delivery system. And so there's a disconnect between what we discover and what we deliver to all American people, a disconnect between what we know and what we do. Patient navigation is an attempt to equalize that disconnect. People should not die of cancer because they are poor. People should not die of cancer because they are uninsured. People should not die of cancer because they are black. This is a moral issue. Thank you very much.